Good day everyone, my name is Chris Daniel Sumawang and I am a student nurse from Tarlac State University from DSN Monby. And for today, I will be performing a performance evaluation checklist about the genitourinary assessment. So first that we will be doing is the assessment of the female genitals as well as the inguinal area. So for the purposes of our performance is to assess for any abnormalities of the genitourinary system, as well as to diagnose for any disorders or any diseases of the entire urinary tract as well as the genital tract. Also to plan a appropriate interventions pertaining to the genitourinary problems. And lastly, to evaluate the improvements as well as the response of the patient to the management. And following the nursing purposes, we will now proceed to the assessment phase. First is I need to determine the following. Um, I need to know the presence of factors increasing susceptibility to infection as well as the possibility of undiagnosed infections such as HIV. And also I need to know the recent diagnostic procedures or treatment that may have penetrated the patient's skin as well as the patient's body cavity. Next is I need to check or review the client's record for the need of genitourinary assessment. And after that, I will need to introduce myself to my client and I need to verify my client's identity. So, good day po ma'am. My name is Chris Daniel Sumawang and I am a student nurse po from Tarlac State University from BSN 1B. And for today po, I will be your student nurse. So, ma'am, may I know your name po? Okay po. So, may I see your stud po, ma'am? Okay po. So, today po, ma'am, I will be just asking po some series of questions po. I need to determine po the client's history of the following. So, ma'am, if may I ask po if kailan po yung ating pong unang menstrual cycle? Okay po. How about naman po yung last menstrual cycle po natin? Okay po. So, wala naman po ba tayong nararanasang pain during po menstruation? Okay po. So, ask ko lang rin po sana ma'am if regular naman po ba yung ating pong menstrual cycle? Yung duration po as well as yung daily flow po? Okay, thank you po. And ask ko lang rin po sana ma'am if kapag nakikipagtalik po ba tayo sa ating partner, wala naman po ba tayong nararanasang pain? Okay po. So, meron po bang mga vaginal discharges po? So, okay po. Wala naman po. And ask ko lang rin po sana ma'am kung have you undergone pregnancy na po? Okay po, you have. So, may I ask po if the numbers of pregnancy po as of now po? Okay, thank you po. And ask ko lang po sana if lahat po ba ng ating pagpe-pregnancy, live births po ba lahat? Okay po, thank you po. And ask ko lang po sana during labor po or delivery, wala naman po ba naging complications? Okay po, mabuti po. And next po is I will be asking po sa inyo pong urination. So, wala naman po ba tayong nararamdamang pain during urination po? Okay po. So, wala naman po bang presence ng blood sa inyo pong urine? Okay po. So, yung urge po and frequency po ng ating pag-ihi during nighttime, normal naman po ba? So, palagian po ba? Okay, thank you po. And ask ko lang rin po sana yung incontinence po if there are any presence of leakage po ng ihi po at any time of day. Okay, wala naman po. And last question po, are there any past and present history po ng STD or sexual transmitted disease? So, wala naman po. Mabuti po. And now I will proceed to the planning phase. I need to plan the proper steps in assessing the client's genital as well as the inguinal area. After that, I need to assemble my equipment. I do need to have an examination gloves as well as a drape and a supplemental light if needed. And now we will proceed to the implementation phase. So first thing that I need to do is I need to secure consent to my client for the procedure, and I need to explain the procedure with my client, and I need to explain why is it necessary, and also I need to uh, assess whether the patient has the ability to assist or to cooperate with our procedure. And so, ma'am, as I have already introduced myself, today po I will be assessing po yung inyo pong genital area as well yung inyo pong inguinal area. So, ma'am, I will be just touching po some areas of your genital area and your inguinal area with my hands po, specifically with my fingers po. Okay lang po ba yun? Okay, thank you po. So, it is very necessary po, ma'am, to determine po if there are any abnormalities po sa ating pong genitourinary system. Okay po? And also po to determine po or diagnose if there are any disorders po as well as diseases po sa ating pong genital tract as well as yung ating pong urinary tract. Maliwanag po? Okay, thank you po, ma'am. And after that, I will be washing my hands. I need to perform a proper hand hygiene and observe other infection control procedures. And after that, I will be performing the glovings. And for my next step, I need to provide some privacy for my client, and I need to close the curtains around the bed and close the windows as well as closing the doors to the room if possible. And after that, for our eighth step, I need to position my client to a supine position, or I need to elevate the patient's feet to the stirrup on the examination table, and alternately I will be assisting my client to a dorsal recombinant position, and I will be positioning my patient's knees, flexing the patient's knees, and after that, as well as the patient's thighs, I need to rotate it externally. And after that, for our next step, so let us assume first that I have already positioned my client to the appropriate position. And next is I will be inspecting now the client's inguinal, the client's pubic area, pubic hair to be specific. And to do that, I will be inspecting the distribution, the amount, as well as the characteristic of the pubic hair of my client. So, for example, this is the patient's genital and inguinal area. I will be inspecting the client's pubic hair in this area, and as I inspect, okay, so ma'am, normal naman po ang ating pong ang ating pong pubic hair. So, normal naman po, even naman po ang distributions po ng ating pong hair sa ating pong genitals. And also po, there are no presence of lice and nits po sa ating pong pubic hair. Okay po? Thank you po. And after that, I will be separating the labia majora and labia minora of the client, and I will be assessing the pubic skin adequately. So, for example, this is the actual the client's vagina. I will be separating the labia minora and labia majora of the client, and I will be inspecting the skin or the pubic skin of the pubic area for any inflammations, any lesions, parasites, as well as swelling. And as I have observed, ma'am, normal naman po ang ating pong area, ang ating pong skin sa ating pubic area. So, wala naman po tayong nakitang any parasites po, any inflammations, as well as swelling po, and lesions po. So, normal po. Huwag po na po kayo mag-aalala. Okay po? And after that, is I will be inspecting my client's vagina. And to do that, I will be inspecting the clitoris, the urethral orifice, the vaginal orifice. When we are inspecting or when we separate the labia minora. So based on what we can see in the picture, the person on the picture separated the labia minora of the patient. So for example, it is me that have separated the labia minora. We will be inspecting the clitoris, the urethral orifice, the vaginal opening or the vaginal orifice of the client. And after that, so we'll be inspecting for any inflammations, any nodules, any swelling on the client, as well as lesions. So, ma'am, wala naman po kayong dapat ipangamba. Normal po ang ating pong vaginal area. So, wala naman pong any presence of any lesions, any inflammations, as well as swelling po. Okay po? And after that, I will be inspecting the inguinal area of my client. So, to do that, I will be inspecting the inguinal area for any inflammations, as well as lymph nodes, any swellings, or if it indicates a inflammations that indicates hernia. So, okay po. So, for example, this is the white part here is the inguinal area of my client. I will be palpating the inguinal area of my client, and I need to inspect or for any presence of just what I've said earlier, which is the inflammations, hernia, or lymph nodes, or any inflammations on the client's inguinal area. So I will be palpating it. Okay. So, ma'am, normal naman po ang ating pong inguinal area. There are no presence of any lymph nodes po. In fact, they are very small po. That is the way it should be po. And there are no presence of inflammations po, which indicates hernia. So, wala po tayong dapat ipangamba. Normal po ang lahat. And after that, we will now proceed to our documentation phase. We need to document any findings on the client's record. And for our implementation phase, we will now proceed to our evaluation phase. First is we need to remove our gloves if worn. So we have worn our gloves. And after that, we will be performing again hand hygiene, or we need to wash our hands after the procedures. After that, we need to reassess our patient for any discomforts and problems after performing the assessment of the genitourinary assessment of the genital as well as the inguinal area of the patient. So that is all for the assessment of the female genital and inguinal area of the patient. Thank you.